McKenna, and my peers and I are here today to educate you on the differences between palliative versus hospice care so that you can one day make the most informed decision for yourself. To kick off the discussion, let's discuss what palliative care is and all that it covers. A person diagnosed with a serious or chronic illness can be a possible candidate for palliative care. Their outcome can be terminal as long as they still want treatment. Examples of these conditions can include, but are not limited to, cancer, heart failure, and stroke, among many others. The reason someone may want to enter palliative care is to receive treatment to potentially recover from their disease while also getting treatment for overall comfort. These comfort measures can include pain management, mental health support, and just any other quality of life improvements they may need while they're going through their disease. Let's look at an example of a person that may qualify for palliative care. This can be somebody who is diagnosed with cancer recently and has started chemotherapy. Due to the effects of both the treatment and the cancer, their everyday activities are becoming more difficult and the pain is just becoming unmanageable for them. This person may want to seek out palliative care so they can both continue their chemotherapy but also just start receiving care to increase their day-to-day comfort. Where hospice care differs from palliative care is that the patient has to have a diagnosis of 6 months or less to live, and they would have to stop all treatment that is trying to combat their disease. This goes to say that hospice is geared more towards end-of-life comfort and not recovering from that disease. The primary goal of hospice is to make the patient as comfortable as possible as they're coming toward the end of their life. To use the same example from earlier, if that patient's cancer, say it's progressed and their doctor is now telling them they only have 6 months to live, they have now become a candidate for hospice care. If they choose to go that route, they would have to cease their chemotherapy, and the focus of their care would then shift more toward providing comfort, such as managing their pain and maybe meeting all those hygiene needs.
Hi everyone, I'm Alchemy, and now that we know the difference between palliative and hospice care, we can start talking about some things that you're going to want to start thinking about. So it is important to start that conversation with your doctor and your family about what matters to you and what you want the end of your life to look like, whether that be managing an illness at home or being in a facility with 24/7 caregivers. You might want to figure out what matters to you in that regard. It also is important to make sure your family is aware of your desires and wishes for the end of your life when you near the end, and also if there are things that you haven't thought of, it might be time to start to think about those things. And if for some reason you don't have a physician at this time, you might want to start looking for one so that when you're in need, they can help facilitate treatment when the time comes. Also, there are going to be some legal documents that you might want to start thinking about filling out. Really, all adults should probably start thinking about having these filled out at some time, but especially as you get older, it becomes more imperative that you have these things done. So this bright green form is our physician-ordered life-sustaining treatment form, and this is going to tell emergency services and physicians how much medical treatment you would like. So that would be things like if you want CPR done or mechanical ventilation, things like that in the event of an emergency. It would also allow you to have control over your medical treatment, even even if you were unable to communicate those for yourself. Another important legal document is going to be your living will. This kind of builds off of some of the things you might put in your post form, but it's also going to outline things such as comfort care measures that you would want at the end of your life, whether or not maybe you want your organs donated, and any other cultural or religious preferences that you and your family might have that are going to be important to you when your time might come. And this can also minimize the chances of your family having to make those difficult choices if you guys don't have these filled out. So you can kind of make sure that that doesn't become a weight on them and that you get what you really wanted. And then also in the event that you would be unable to make decisions for yourself, you may want to consider assigning somebody that you trust to be your durable power of attorney. This is somebody who can make financial, legal, or healthcare decisions for you in the event that you're unable to make those for yourself. This document can also be revoked if you choose to go with somebody else. It's not a permanent choice, but it would be effective until the time of somebody's death. And this can be a relative or even a friend. It doesn't have to be somebody who's related to you, just anyone that you trust to do that.
Hi, I'm Reese. I'll be talking to you about the difference between life with palliative care and life with hospice care. So I'll start with life with palliative care. Palliative care gives you the ability to continue to receive treatment for your terminal disease, such as chemotherapy and radiation, but also allows you to receive pain management and comfort. Palliative care also allows you and encourages you to maintain your daily activities like exercise, a healthy diet, and regular outings so that you can still do the activities you enjoy. This care doesn't only supply physical support, but it also supplies mental health support for you and your family members as well. Now, what does life with hospice look like? Like palliative care, hospice provides pain management and comfort. Comfort measures may include personalizing your environment, such as your own bedding or adding photos of your family. The biggest difference is that hospice stops all treatment of your terminal disease, although some medications are still given, but these are to provide quality of life and comfort, not to treat the disease. These could include IVs for hydration, anxiety medications, medications to help nausea, and treatment of issues that may cause discomfort. Not only does hospice provide physical support, but also spiritual and mental health support for you and your family. They have chaplains for your spiritual needs and a social worker for your emotional issues that may develop. A big concern is being stuck once in hospice, but you will be allowed to leave at any point in your care to get treatment for your disease. Some diseases may improve over the course of hospice, which also can lead to the discontinuation of the care. Throughout both palliative and hospice care, regular physical and mental health screenings take place so that the care you receive can be accommodated based off any changes that may occur.
Hi, I'm Olivia. I'm going to be talking about promoting your health. And just because you have a diagnosis or you're battling an illness doesn't mean that you can't take active measures to improve your quality of life and just promote general health. A few ways to do this are through some of the community resources that we provided. We chose to provide Virginia Mason Franciscan Health because they're just so prevalent in our area, and they have hospice services and palliative care services that are just readily available to everyone in the area. If you, if you have, major insurances, they accept those. The Bremerton Home Instead is a resource really in Bremerton, and it focuses on home health for both palliative and hospice care, and they help with household tasks like even laundry and nutrition management, as well as medication management at home. The Family Caregiver Support Program, that is found on the Washington Department of Health website, and it just provides family members and caregivers resources to get mental health support so that they can better provide care to their loved ones. And then the Continuum Care of Washington is another resource, just kind of like the Bremerton Home Instead, but they're kind of more located in King County, Pierce County, but they also provide in-home services for both hospice and palliative care. Another way to promote your health is through lifestyle changes. Just because you're fighting an illness doesn't mean that you can't make good choices. So having a healthy and balanced diet assists, especially with palliative care folks, because it helps with avoiding disease progression. It can also help alleviate some negative symptoms that are associated with poor diet and poor hydration, like like nausea or cramping or confusion even. Physical activity is a really important one, and it can look different for many people. You can do it in your house, you can do it in your bed, and it just promotes general strength and helps prevent falls, which cause unnecessary complications. And then you have proper hygiene, which might be one of the most important ones, because improper hygiene, so bad hygiene, leads to a lot of other infections over here in quality of life. For example, like poor bathing habits can cause UTIs and skin breakdown infections, and poor oral hygiene can also lead to a lot of infections, which people are already going through enough. You don't need unnecessary complications. So common questions that people have when entering either palliative care or hospice or just getting ready for that stage of life. What if I change my mind? I know we already kind of discussed that with Reese, but pardon me. It's completely fine to change your mind. You're in control of your own care. You need to be able to advocate for yourself, but it is really important to note that if you do change your mind while in hospice, you may lose your hospice benefits. So that's something to really discuss with your primary care provider or hospice provider. Does hospice care mean that I'm giving up? No, it does not. It just means that you've reprioritized what's important to you, and that instead of fighting the disease, you've prioritized peace with your diagnosis and quality of life and comfort in your remaining days. What support is available for my family and caregivers? Community is a really important thing to have. They help you get through hard physical and emotional stress, so it's natural to worry about them. However, luckily, with most hospice services, they provide a lot of support for family and caregivers, both during hospice care and after the passing of their loved one. And that looks like support groups and bereavement services. What if I don't live near a hospital? This is also a common concern, especially for people within this area, because a lot of people live rurally, so health or access to health services is limited. However, there are a lot of hospice services that offer in-home care, so even though you don't live near a big hospital with hospice inside, you can still have those services at your home. And finally, how do I pay for this? This is probably one of the biggest concerns that people have, because economic stability and cost is a big concern. A lot of people think hospice services are out of reach or not an option. However, most hospice services accept both Medicare, Medicaid, and VA benefits as well.
All right, and then just lastly, we just wanted to provide a handout for you. So if you need to refer to any of the information that we've given you here, you have something to refer to, and also some resources if you visit the website here on the next page. Visit these websites and you can kind of look more into some of the resources that we've provided. And thank you for your time.